That the Vascular Birthmark Foundation, or we would like to refer to as VBF,
okay,
is the leading not-for-profit in the world for children and adults born with a vascular birthmark. Vascular birthmarks, the most common birth defect in infants. People typically call them strawberries or angel kisses or salmon patches. They refer to them as more pleasant sounding terms than what can become really problematic and life-threatening, which some of these lesions can become.
Now, the Vascular Birthmarks Foundation International was founded by you, and you founded it for very personal reasons, because of your daughter.
Yes, my daughter was born in 1994, and she had one of these vascular birthmarks, also called a vascular tumor, called a hemangioma, which means blood-filled tumor. There was no internet at the time, so you have to remember there was no cell phones, no ways to look up these things. And so when the doctor told me she had a hemangioma, and I said, well, what is this? What's the prognosis? He said, well, we don't really know. They're very misunderstood, yet they're the most common birth defect in children. And I couldn't believe something that was so common, with 1 in 10 children being born with one, had no information, no books, no resources for families. And the prognosis was this could be small, this could be big, this may be insignificant, or this may be life-threatening. And I found that to be very disturbing and frightening at the same time as a new parent.
Well, you ended up having to leave town, and you went to Boston, right?
Yes, I did. I went to Boston because I found out the author of the only book written on the subject was a doctor at Boston Children's Hospital. I made an appointment. I brought my daughter there. She was 6 months old. The tumor at that size, which was on her lower lip, was the size of a golf ball. And his first comment to me was, why didn't you get her here sooner? And I said, but my doctor said there was nothing that could be done. He said, that's not true. We could have put her on steroids, we would have shrunk it. And I said, why don't people know about this? And he said, because it's the most misunderstood area of medicine. It was at that moment that I knew that God gave me a child with one of these lesions so that I could make the unknown known.
Now, what did the doctors do with your daughter, who was 6 months old at that particular time?
Well, at that time, this doctor prescribed steroids to see if it would work and shrink it. So he put her on the steroids for 6 months. She had some negative side effects. We ended up having to take her off. It never shrunk the lesion. It had no effect on it, and that was because it was too late. So at that point, we had no option but to start looking at surgery, and what he called multiple surgeries that would occur till she was 5 years old to try to restructure the lip to a more normal lip.
Now, I've met your daughter over the years, and you would never know. I mean, obviously, this guy was good.
He wasn't the surgeon that did her surgery, because it was very serendipitous that one time in the waiting room to see him, I ran into a mother with a daughter with the same condition who said, did you know there's a doctor from South Africa that's been recruited to Little Rock Children's Hospital, and he's now removing these tumors in one outpatient procedure? And I said, well, what's his name? So she told me his name, and I went home. It was a 3-hour drive from Boston to Albany, came back home, and I said, well, I'll call Arkansas Children's Hospital. I'll leave my information with his secretary. I called the number. It was 5 o'clock their time, 6 o'clock our time, and this man answers the phone and says, hello, Dr. Wayner here. And I'm like, what? A doctor answered the phone? And I stumbled through my story of my daughter, who was at this time now 9 months old.
Right.
And I told him my story, and he said, do you have a Polaroid? Because remember, there are no digital cameras. Right. I said, yes, I do. He said, take as many pictures as you can and FedEx them to me. Again, we have no other way to send things in '94.
Not even a
FedEx,
fax.
Right, not even a fax. I overnighted the pictures to him. He called me Sunday night at 9 o'clock. And he said to me, I can have your daughter looking normal in a 2-hour outpatient procedure, versus what I'd been told that it would take 4 or 5 years, 3 to 5 surgeries. I booked my flight. We went to Little Rock, Arkansas, true to his word. In 2 hours, my daughter was transformed from this large vascular tumor to a normal lip. I hadn't even seen my daughter with a normal lip since she was born, and by this time she was 18 months old. So I almost didn't recognize her, and I just started crying, and all the nurses were crying because they also noticed this was like a miraculous transformation. And I looked at him and I said, Dr. Wayner, you're the one I'm going to write the book with. And he looked at me and he said, would you like to come to dinner tonight? And I went to his house for dinner and we started talking about the book. And I said, I've started a foundation. I'd like you to be a part of it. And he said, I'll be happy. And our book was published 2 years later. And it still remains to be the only book written for parents, called Hemangiomas and Vascular Malformations. And he's still very much a part of the foundation as we enter our 20th year.
I mean, obviously, with the gleam in your eyes, he's obviously still a part of your life.
Yes.
And your daughter has gotten to know him as an adult now, too.
Yes.
That must be very, very special.
What's so special is, if you think about it, her defect was a tumor that consumes 75% of her lower lip.
Right.
Her mouth was so swollen from the tumor that she had to wear a bib all the time, and it was affecting her speech. Today, she sings opera with that lip, and she performed in 2008 in New York City at our gala with the Phantom of the Opera. She sang.
Didn't you have her sing at your event that I emceed last year?
Yes, she did.
Oh, okay.
She sang the national anthem.
Okay, I remember that.
And I just think that that's a God story, because who would think that a child that had this massive tumor on her lip, I would have never thought it, would one day go on to be a singer.
One thing I learned from you when we were preparing for the show the other day is I mentioned to you, as a little baby, I had a birthmark on my left arm. And I remember there was like a circle on my arm, and it was kind of funny, and the rest of my skin was normal color, but that was white, and I never really thought anything about it. And I asked you the question the other day, with the exception of cosmetic reasons, is it really necessary, if you have a birthmark, to have an operation? And you explained to me, whoa, there's a lot going on under that birthmark. Could you tell our viewers about that today?
Well, as I said, 1 in 10 babies are born with a vascular birthmark.
Right.
In our country, that means, like, there's 4 million new births a year. Of those 1 in 10, 1 in 100, or 40,000 children a year in the U.S. have a vascular birthmark so significant they need to see a doctor. In other words, it's not just a little tiny red dot that the doctor tells the parents, leave it alone, it will go away.
Right.
It begins to grow, and it begins to either obstruct their vision, obstruct their airway, obstruct their speaking. They can be internal on their liver. They can be on other organs. They can be in the diaper area, so every time the baby goes to the bathroom, they cry because of the pain. They can erode the tissue. A lot of them occur, 85% occur in the head and neck. So the ones that occur on the nose, they become very large and they can erode the cartilage. So these aren't all just benign, disregard them. Some of them can be very problematic and life-threatening. And I've actually held 2 babies who passed away because the hemangiomas were on their liver and consumed their platelets, and they died, and it broke my heart. And we actually have set up, little physician education programs in honor of these children, because if the physicians had known what to do in these remote countries, in these remote locations in our own country, those babies would have been alive. But there was no education. They didn't even know what these were, let alone how do I treat them.
Well, I was born in Brady Hospital in Albany, and my parents must have lucked out, and obviously I lucked out. There must have been a physician there who said, you got a birthmark and this has to be taken care of right away. I just never thought anything about it, but it does a lot internally.
Well, it's interesting because every once in a while I'll meet someone who was born in the good old days that will tell me they had a hemangioma and that their parents were really assertive and were able to get a surgeon to remove it or to treat it. One of the downsides is there was a treatment in the 50s, 60s, and 70s, which has now come full circle to be quite problematic, and that is where they were using radiation implants inside of these hemangiomas, and they were dramatically shrinking them, and the parents were happy. We're seeing these adults now 30, 40, 50 years later in those locations coming up with melanomas and skin cancers. So the VBF has been collecting data on these, and we have a significant number of patients who are now in their 50s and 60s who had these radiation pellet treatments and are now experiencing types of skin cancer.
Tell us about the Vascular Birthmarks Foundation International. First of all, you founded it. What exactly is the role of your foundation around the world?
Well, we actually have 3 primary objectives, and I am still today the president and founder. Our first objective is to educate physicians and families. What is this birthmark? What are my treatment options? We are working right now with, excitingly, the American Academy of Pediatrics to get new guidelines out to all primary care doctors that these should not be dismissed and that these babies need to be referred to a specialist to have the specialist determine what type of treatment they need, whether it's laser, drug, or surgery. That's our primary objective. Our second objective is our international missions outreach, where I bring a team of medical physicians to a remote country where they do not have knowledge about how to diagnose and treat these lesions. We do a full day of education where we lecture, 8 to 10 physicians and myself, lecture on the various types of birthmarks. Then they operate for 2 full days free. They donate their services, they operate on as many children as they can operate on, and at the same time they're educating and training the doctors in these countries how to remove these. After they come back, and I bring the team back, then the country chooses a physician as an expert who then comes to New York and spends an additional 2 weeks with one of our treatment specialists to get even more experience. So that's our international outreach. We've been to Moscow, we're going to Delhi.
I was going to ask you about your trip.
We've been to Moscow.
What happened in Russia?
We treated 125 children for free.
Right.
To date, it's been a little over a year since we've been there, and they have treated over 400 children. So this is a real paying it forward endeavor. We're not just removing tumors, going home and leaving them. We're establishing a clinic, a treatment center that can sustain itself. We're going to India soon. We've been invited, and we are scheduling a trip to the Ukraine. We've been invited to Canada, and we've also been invited to China and Israel, which we're hoping to do in the next 3 years. Since these doctors volunteer their time, and it is a time-consuming endeavor, minimum of 5 days that they have to leave their practices, I try not to schedule a trip more than once every 9 to 10 months. And I also try to give different doctors who are interested a chance to opt into one trip and opt out of another. So some surgeons may go to Russia and others may go to India, but that's the international program. We also set up a VBF International website in that country. We have 12 international chapters. We are on every continent in the world. We get 2 million visits a month on our chapters. Russia is our second highest. The United States is our highest, of course, but Russia is our second highest with 400,000 visits a month alone. And the third component is our newest campaign, which is our Ask, Accept program. It's an anti-bullying campaign. Ask means ask me about my birthmark. Don't judge me, criticize me, or make fun of me. Ask me about it. And then accept me. Accept me. This is a part of me.